So the word is we have till 10 after 3, and we have 6 incredible people to hear from, which, if you do the math, means they have about 3.5 minutes. So what we're going to do is try to have, as much as we can, a conversation with the panelists here. And what we've done is we've put together, we have 3 people from cities who are in the process of implementing strategies that are much more focused on evidence and results. And 2 of those cities are Philadelphia and Baltimore. And so we're going to engage in a conversation with those folks, if we can, just to hear an example of what they've done, and ideally, hopefully, what they think from that work that they've learned from it that others could learn from. Then we have Mindy Tarlow from New York, who just took over operations for Mayor de Blasio and is in charge of operations and trying to have their whole operations be driven by that. So Mindy's going to talk about the approach they're taking to that.
It's all taken care of.
Yeah, and that's still within 3 or 4 minutes, right? That should work well.
Yeah.
3
months, 3 minutes, everything.
And it's 5 whole boroughs.
Yeah.
And then we have 2 funders, one from Bloomberg Philanthropies and one from the Annie Casey Foundation, to talk about their approach to supporting this kind of work at the city level. So this could be an amazing 3-hour panel, but as you see, we have about 40 minutes. So we're going to do the best we can with what we have. And maybe we'll start with the city's perspective, and maybe I'll start with you, Suzanne, if you don't mind, and just briefly say kind of how the city's been looking at that, an example, what you learned from it, and if you don't mind, I'll cut you off after 3 or 4 minutes just so we can get kind of everything out there on the table.
Absolutely. So,
thank you.
Yeah, thanks for having me. So I think, so in Philadelphia, we'll start with the Great Recession, and because the speakers talked about it in the previous session about a lack of resources really focusing the mind on what works and what doesn't work. And when you combine that then with a new mayor who had created a team of senior advisors, deputy mayors, finance director, et cetera, who were really focused on outcomes and not outputs. Those 2 things, I think, collided into some really good, innovative work that's been happening in Philadelphia in a variety of areas. So I'll sort of briefly mention a few things. So our health department has started an entire campaign called Get Healthy Philly around lowering obesity rate and tobacco usage. And they're coming at it from media, they're coming at it from the built environment, and even things like changing corner stores and how they display fresh food versus junk food, and trying to use behavioral economics and sort of the nudge features to get people to eat, and children especially, to eat better food. Our police department is changing sort of the traditional CompStat model where you're looking at crime data and reacting to it, and starting to think about using predictive analytics to think about who's actually committing these crimes, lower level crimes, who are they associating with, and then trying to determine who will be murdered next, essentially. Targeting those children, juveniles, usually 18 to 24, and bringing them in ahead of something bad happening to them. In human services, we're using performance-based contractors based on outcomes, not just, so for example, it's not just how many children you are trying to help, and you get a per child fee. What happens to that child? Are they reunited with their family, not just for a week, but for 6 months, and you're paid on that outcome versus the fact that you served the child? Those are hard conversations, obviously, for city to have with providers who are used to doing just getting paid for the number of kids they serve. But it's actually Casey Family Programs, not any Casey, but Casey Family Programs really helped us think through that model. And I think for what we're seeing is that the outcomes are shifting, and we are getting results because of what we're doing.
And Eddie, what's been the reaction internally?
So,
has it been embraced?
Yeah,
when Mayor Nutter leaves?
Yeah, I mean, it was funny. I actually had a conversation with a senior person in the health department 2 nights ago on our train ride home, and she was talking about how we've got great leaders who've brought in with this administration, but there are always a series of people who were there when you started and they're going to be there when you leave, who were overheard, I guess, last week saying, "I'm so tired of talking about results. I wish they would just, we have 18 months left in this administration. I wish that we could move on from this." But I think it is seeping into the culture of most departments, and I think even within the health department, I'm a little facetious, but because you do see that lives are being changed, and knowing that the things that you've implemented have made it so they help boost morale within the department, have everybody focused on a mission that can hopefully continue that change through the next administration, and really have the public demand for that.
So Bob, can I go to you, Baltimore?
Sure. So in Baltimore, first, thanks for having me today.
Thank you for being here.
In Baltimore, we started about 4 years ago. What was our fiscal year 2011? We do an outcome-based budgeting approach. It's a much different really than what we had done before. Before we used to build our budget by agency. Police department, public works, health department, and if we had a fiscal problem like we were facing in fiscal 2011, we would basically give reductions across the board to all the agencies, 2%, and say everybody figure it out. And what we found was that we were just not making strategic decisions at all. We were just kind of giving everybody a haircut essentially, and a lot of the discretion was with the agencies to figure out how they made those cuts. When we came in, we switched to this outcome-based approach, and what we did was we actually we worked with the mayor and her staff to really build like what are the key goals, what are the key things we're trying to achieve at a very high level, and then choosing measures, things that we can actually measure over time. And then we asked our agencies, rather than to give them the discretion how they build their budget, they would actually make a proposal to finance, to teams that we set up to try to explain how they were driving those outcomes that had been chosen. And so in the first year, the story, because the fiscal crisis was so bad, the story was more around what we cut, which was unfortunate because I think we didn't get as much buy as we would have liked from the agencies, because they said, "Oh, this is just finance," with another excuse of how you do programs. But I do think the things that we cut were the lowest value services that we had, rather than taking money away from some valuable programs. So I shared with a couple others earlier, we completely eliminated a prisoner reentry program. Really tough conversation, which is no evidence that it was working. We significantly reduced our liquor board staffing last year because we did some analysis that showed that they could do just as much work with much less staff. And as the fiscal picture has strengthened a little bit, we've been able to add back a component to our program of not just choosing the lowest value things that we have to reduce just to balance the budget, but to also give agencies an opportunity to do what we call enhancement requests, to put more money towards not just filling the gaps of what they already do, but innovative ways to drive programs that get us results. So we awarded funds to our housing department last year to invest in illegal dumping cameras. We had this problem where contractors dumping things in alleys, and they said, if you just give us $300,000 and put cameras up, you're going to bring in more revenue because you're going to catch them and find them, and you're going to start deterring folks from doing that. Very small investment, something that they couldn't fit in their base budget because their program budget was so tight. And when we made those reductions at the bottom end, at the lower value stuff, we were able to even invest some funds and some stuff at the top. So I think it's been a really positive experience for us. I think one caution, I guess, to folks that we've learned is that really, and I said this a couple of times, it's really an art and not a science. I know everybody's room, they love data, they love science, and they want the numbers to add up, but it's good I think for local governments, because you're forced to make your decisions every year because you have to balance the budget. So when you're looking at this list of programs, you frankly don't have time to go back and get help from the nonprofit sector or something to do an evaluation. You just have to choose. And sometimes, even though you're using data, you're using a lot of input from agencies, you just don't have time to verify every little piece of it. You have to use your judgment sometimes.
Interesting. And how much would you say that the connection of cutting budgets was related or more easily adopted when there was that sort of innovation piece that was available, like the cameras? Because I hear a lot about sort of the movement towards evidence-based stuff and having resources to also be innovative. Makes it a lot more, people get more passionate about it.
Yeah, I think it was. I think it really helped it energized the agencies, because in those bad years, they just felt like they were getting hit pretty hard. And what we did was, in really last year, 2 years ago, fiscal 13 and into 14, when we were able to fund some of those enhancement requests, even if they were just a couple $100,000, which is really a drop in the bucket in our budget, when we presented the budget, we were able to frame it that we were reinvesting. So we were taking away money from these lower performing things and investing it in a couple things, which I think definitely helped the story and politically helped the story, because it wasn't just all about cuts. Right? We would go to council to present the budget. It's hard to talk about you're cutting a low performing program because it's still serving somebody, or there's still people that are attached to it. But when we say we're reinvesting, we have more positive stories to tell, and I think that's helped, especially in the last couple of years.
We're on track. We'll even have time for a couple questions, I think, if we stay on track. Mindy, no pressure. But I think it's kind of fair to say that Mindy's coming into New York to try to take the best of what they've been doing in some places and try to say, how do you mainstream it everywhere? So maybe you can give us the context of what you're trying to do in New York, knowing that it's a work in progress and only 60 days old.
Well, no, we passed that 100 days.
Oh, the 100 days, that's right.
It's a big milestone. So, for those of you who don't know, Mayor de Blasio came into his mayoralty with a big mandate and a big focus on issues around inequality. Inequality kind of defined writ large, not just about income, but about inequality of a whole host of areas, access to services, universal pre-kindergarten being one of his signature issues, but also access to basic services, distribution of services, just a sort of broad definition of that word. And as his head of operations, meaning the mayor's office of operations, which is really charged by charter with performance management for the entire city and accountability for performance for the entire city and cross-agency functions and all that good stuff. You can't really do that in a vacuum. You have to be doing it about something. And in this mayoralty, we're going to be doing it about issues of equity, equality, inequality, however, you want to frame that broad word. And that's what we're charged with doing, which is the reason that for those of you who've been, watching New York City at all, or who've been to these events in the past, you know about the Center for Economic Opportunity. Well, the Center for Economic Opportunity, which is now headed by Matt Klein, who's sitting over there, formerly of the Blue Ridge Foundation, has been moved under the Office of Operations, really for the express reason of helping to support the mayor's equity/equality agenda, which involves helping to create equity and equality indicators all across the city, monitoring those, putting the mayor's platform on the ground, which is not just about performance management, but about project management and about how the two things relate to each other. So that's how we're sort of starting out. You have to start by putting things into practice and putting the indicators on the ground that you're then going to hold yourselves accountable for. And a lot of people around the room know that it all is really about what things add up to, and they can't add up to something if you're not building them along the way. And so that's what we're in the process of doing right now. It's actually a pretty exciting time. And we're building what I would call a delivery system for that and have it act as a central place for that to happen. So one thing I want to say that just happened recently, which is sort of our first early example of how we're going to set the framework for all of this, is that we just released the CEO poverty report, which you may be familiar with, which is really picking up on something Gene Sperling said this morning about identifying the problem, what I would consider to be evidence of the need, which is really where it all starts. We want to have evidence of solutions, but you really have to start with where the need is and being able to have evidence of the need itself. You really can't find a whole lot better an example of really high quality evidence of need than the CEO poverty measure, thanks to the incomparable Linda Gibbs, who's here somewhere. I saw her floating downstairs earlier. And that was a really great place for us to start. But what we did with this poverty report, which is, again, to establish the framework for how we're going to go forward, is looking at the poverty report and what it actually showed, its findings for this year, which is actually a 2-year lag, showed that people who were working, employment is actually going up, but wages continue to lag, one big finding. And another was that population is spiking in Asian communities, particularly in non-citizen Asian communities. And so what we did with those 2 findings was talk about specific programs that we are implementing that respond directly to those specific findings. Not poverty writ large, not, here's a million things in the mix that we're doing, but specific things that we're doing that respond to this specific evidence of this specific need. Also, we talked specifically about some of the things that we're doing have very strong evidence around big, comprehensive workforce development initiatives like sector-based training. A lot of good randomized control evidence around those. Other things like the municipal ID program that we just there were hearings around at the city council yesterday. That's based on a different kind of evidence. What other cities are doing, as you just said, and trying to follow their lead or learn from their transparent mistakes that they've been kind enough to share. Different kind of evidence. You have to start somewhere, or you'll only do 3 things. So we were trying to set the framework in that regard as well, that we are going to do things that are data-driven and evidence-informed, acknowledging that not everything we do is going to be at the highest level of evidence. And when we choose to do things that are at what I would consider to be lower on the spectrum of levels of evidence, we're going to use the Center for Economic Opportunity to help build the evidence as we put those programs on the ground, so we can help build the field, learn for ourselves, and help share that knowledge with others.
Fabulous. Transition to...
Oh, and one more thing.
Yeah, please.
I learned yesterday when I had to submit my name to the city council to testify that the name Mindy, when you put it in a smartphone, comes out as money.
That's the default?
So yeah, so it's pretty good with the whole Moneyball thing. So.
That's excellent. That's excellent. And
Money Tarlow. Like, I should have known that when I worked at O&B.
That's awesome. That's a great nickname.
Yeah.
But, and as many of you know, that Mindy went in her previous job 100 days ago, helped to complete what was the 3rd or 4th pay for success transaction in the U.S. At her own CEO.
That was the only reason they let me leave.
No, it's a great resource for that, for those who are interested in that.
It's going fantastically well, and my successor, Sam Schaefer, is here, and they've done it. Yeah, it's going very well. I think it's really great program.
Excellent. So maybe we can shift to the couple of foundation folks who are here, who do a lot of work with cities. They can talk about, with their perspective on this, the role of philanthropy in doing this, their perspective on the city's ability to do this. Maybe I'll start with Matt and then go to Scott. Matt's with Bloomberg Philanthropies. Of course, we know Bloomberg Philanthropies played a big role in the prior administration in New York, being Bloomberg mayor. But really has innovated not just in New York, but in other places on trying to drive this. So Matt, maybe we could get you to share some of your findings on that.
Great to be here with everyone. So let me just take kind of 30 seconds to talk about what the mandate of the government innovation team is. So what we're really focused on, I think innovation and evidence sometimes look like opposite sides of the coin, but I think we view them very much as one and the same. So we approach our work in 2 ways. One is broadly promoting innovation in local government, so how we make innovation the core capacity of governments, not something that's ad hoc, but something that's institutional and everyday. Second, by spreading proven and promising ideas among cities. I think cities are increasingly getting better, as we heard in the opening remarks. They're spending more and more time collaborating, but there's still a ton to learn from one another and a lot of reinventing the wheel that happens. We believe deeply in cities and mayors specifically as laboratories of innovation, as places that are good examples for benchmarking and comparison. They're where most of the people are. They're where citizens feel most directly connected to their government. The level of trust is the highest. When it comes to how we're thinking about evidence, I think I'll spend less time talking about our existing programs and more about some new work we're doing. But I think building in this data and evidence component when it comes to innovation, our inaugural Mayor's Challenge, which I helped co-lead last year, very much embedded at that because the spirit of the competition was to build big, bold ideas, but also ones that were replicable across cities. So there was a high burden of proof as we went through the process and now that the 5 cities are implementing to understand what is the kernel of the idea, what is the proof that it's working, how can you make an evidence case for other cities that they should adopt this, because in the environment we're in now, there's a lot of calls for innovation, but mayors really want to know they're implementing proven programs. So Mayor's Challenge are innovation delivery teams, which we have in 5 cities, which are following a deliberate 4-step process to generate new ideas, implement them, track their progress over time. The new area where we're starting to do work is broadly in thinking about how cities can be more data-driven and evidence-based. And as a result of that, a lot of work, we're still putting the kind of meat on the bones of the initiative. But let me just talk about the scaffolding and some of the key skills and capabilities we've seen that cities need. There's a huge continuum, obviously, for where the top 200 cities are in terms of what they're able to do today. But 4 key things have emerged. I think the first I'll call what already works. So there's a need to do horizon scanning, kind of a field scan to understand the best of what's out there. And in a lot of cases, cities just don't have the resources to do that. So I think it's an interesting role for philanthropy and other sources to play. We see a lot of clearinghouses and evidence hubs, but I think there's something to that bit. The second is the practical everyday evaluation. So what's working right now? How do I understand in real time what's happening so I can make decisions to scale programs, to decommission programs, to take certain elements of programs that work and what doesn't work. Then I think there's the more forward-looking piece, setting a vision for what good looks like in city government. I don't, to the best of my knowledge, have a clear sense that someone's saying, in a technology standpoint, I think folks can say evidence and data practice is what that looks like, but in terms of the skills and capabilities of how we want to build the next generation of public leaders to be able to do this work well, there's a lot to be done there, so leadership is a core part of it. I think lastly, this decommissioning piece, which came up in Jean's opening remarks, it's the dirty secret of the what works world, that there's a what doesn't work world and what you need to do with all of that. And I think there's a data story as part of it, actually tangibly understanding what's working and what isn't, but much more so it's a change management story. How do you build, you could call it a coalition against the entrenched status quo or the entrenched interests who want continuity of services, how you actually can reapportion and look like, as we also heard in the comments, you're not just taking away, but you're reinvesting in something works better. I think there's a lot of important work around that space that needs to sort of detangle all the sacred cow programs that have just been funded in perpetuity, because we can talk about the small wins, which I think are important in terms of both starting new programs with a strong data and evidence base, but unless we're thinking of the 3 goals of Results for America, the first big one being around shifting more dollars on programs that work, those dollars likely need to move from one place to another. So all that to say, we're doing a lot of kind of thinking in this space. We'll be creating work around it, but there's a lot of good work for cities to do, and certainly other levels of government as well. But I think cities are a real kind of experimentation place and breeding ground for how to understand how mayors, especially in strong mayor systems, can take strong stance on this and actually help move some of the funds.
And Matt, real quick question. On the decommissioning stuff, have you yet put out feelers to see what kind of appetite there is for people to work on that? Because that seems like the most politically. Everyone loves innovation, and I don't think anybody loves decommissioning.
No, it's great. And it sounds like someone said it sounds like you're getting rid of old ships. It's
Yeah,
not.
right.
It's probably a better word for stopping programs that don't work. But I think there's, it's interesting. One of the windows we're seeing where, just thinking about the Mayor Bloomberg, Mayor de Blasio transition, I think new mayors have an incredible mandate to do this. And so in some cases, they just have the executive power to choose. But I think it's an interesting moment in time, both in the transition team period, as well as in their first 100 days, to show that they're making program management and funding decisions based on data and evidence. So I think that's one element of where people are excited about it. And I think the CEO in New York has great examples of basically taking a suite of programs, looking at the evidence base and saying which ones do we scale, which ones do we need to understand more, which ones are we not producing findings for, so we should sunset. And I think that is something that Mayor Bloomberg believes deeply in, is this appetite for risk and experimentation. I think we heard about it in the VC context from Ron earlier, but how do we create a more experimental government that doesn't make such big bets early on, that they can kind of pilot, fail fast, see where things are working and not, and take those things to scale. And I think there's some great emerging examples of that, but I think that's a cultural and mindset shift as much as it is building kind of data and evidence around it.
Fantastic. Scott, mind if I move to you? Scott Spencer with the Annie Casey Foundation. Been very active in Baltimore and other places. But anything you want to share about how you guys view government and what you've seen? You've seen a lot personally in this area.
Yeah, we've done a lot of work over a number of years in a number of areas, from seeding work around the Opportunity Compacts in Maryland, which are really around evidence-based programs that actually can, where there's investments that are shifted to really expand the opportunity for low-income people or disadvantaged people, to avail themselves of good programs and practices, and actually seeing an uptake in those. But the thing I actually want to focus on for a couple of minutes today is our work in green and healthy homes. Since there was conversation in there about the stimulus, Green and Healthy Homes initiative actually started out as the weatherization work that came out of the stimulus package, and the promise of all this siphon of money that was coming through to weatherize homes in low-income communities, that had that been done the way it was proposed, would have probably created sicker solutions in those homes. Tightening up sick homes would only make them sicker. And so GHHI really sought to do a multi-level intervention based on health, based on safety, and based on thermal comfort, or heating comfort in the household, but doing it as a single point of assessment and a single point of intervention. And what was found out through Green and Healthy Homes, at least in the first round, the first couple of years, was that on average, the single assessment and the single intervention, rather than having it done piecemeal one at a time, saved about 28% in costs from the federal government on doing that work. So you would get the weatherizing done, you would get the lead pavement done, you would get the pest management work done, you would get the handrails done, so you would prevent trips and falls in the household. And it would actually provide for families, particularly those families that are at the lower end of the income scale, and those families who were seeing themselves using the emergency room as their first source of health care, from going into the emergency room multiple times, kids losing multiple days of school, and parents losing multiple days of work, and therefore not being able to basically climb the economic ladder to success. That work now is actually being monetized by our peers out in California, the California Endowment. They're now looking to see, whether we can actually understand what the value of those investments in green and healthy homes are, the savings investments in the healthcare system, as a way to look for possibly a type of a pay-for-success model to expand and scale up the green and healthy homes effort. Because for every emergency room visit, it's about $5,000 to $8,000. The average cost of doing a green healthy homes assessment is around $6,200. And when the kids, in some examples in Baltimore, kids were going to the emergency room 6 to 8 times a year prior to the GHHI intervention. The outcome of it is that some of those kids would spend 18 months without having to go to the ER for a respiratory-related illness. So those cost savings, if you can start to monetize that, you can actually make a case for shifting those investments, just like in a compact style or in a pay-for-success model, and actually investing those back into those households.
And how did you guys at Casey view your role in all of that?
We were, in Baltimore, specifically in Baltimore, we started out by being part of the table hosting for a collaborative of funders, practitioners, government agencies in Baltimore. So the Maryland Energy Administration, the Public Service Commission, our public utility, which was then bought out by another public utility, was a partner at the table. Several nonprofits that actually did the work of the intervention, the Coalition to End Childhood Lead Poisoning, and Civic Works, who actually then provided skills and job training for low-income workers to be able to do the intervention work. Basically sat at the table for 2.5 years. Casey and the Baltimore Community Foundation were the sort of conveners of that table setting. And over the course of a couple of years, with the very active involvement of the other partners, the city actually has created its own office of healthy homes. And one of the greatest, I think, especially if you're the person who's at the end of the service chain, you're the person who has to go to the office and try to get the service. One of the greatest things that came out of that was that there were 4 agencies within the city that were doing elements of this work. And as a result of this, the city was able to basically consolidate those offices so that the person who's being served has one point to go to be able to take advantage of those services. And as a result of that, and as a result of the work of the table setting and the sort of the ongoing work, when Constellation was bought out by Exxon Corporation, there was a major pile of money that was made available for grants. The city of Baltimore was awarded $52 million in order to effectuate this plan. So I mean, in a certain way, what we've gotten out of it has been from a demonstration of sort of outputs sort of being the houses. The outcome that we've gotten has been a pretty large investment for a system reform and a chain system within the city government that actually helps the people at the end of the pipeline that we're really trying to serve.
Great, so let's open it up for questions for these guys, or other experiences that people have had that would add to this pretty rich body of information.
Andy Feldman from Office of Management and Budget. I'm curious to hear, are there next steps yet in the works for the CEO meeting Center of Direct Opportunity? I know there's two great CEOs in New York City. One used to run, just to be clear, one used to run and one is in the mayor's office. So are there next steps on the vision for pocket development?
Well, I mean, what we can say for now is that we're trying to integrate it into the sort of city vision writ large for how we're looking how to look at everything we do in the city through the lens of equality and equity, and using the CEO as both a staffing apparatus for doing that, kind of like if you look at Plan YC, which is what the city did for sustainability, and they had an Office of Long-Term Sustainability that was helping to support that effort. Thinking of that in some similar terms, and that's sort of a loose framework. It's a loose framework. And Matt, I don't know if you want to make some other comments about where you think we're starting to head.
No, I think the original vision that you would identify opportunities that, if they were scaled up, perform better than whatever the existing benchmark is, remains an important vision. The scaling up part is very critical, I think, in this administration. And that involves having agencies and commissioners be committed and interested in thinking about using CEO as a lever for their own change internally about things that they would like to see improve, and us being a partner to them in helping advance that work.
Yeah, and we have been making our rounds to the deputy mayors and commissioners and sort of offering that up to them, and you know presenting ourselves as a safe place for them to try things and all of that. And we also have some resources that we'll use sparingly, but we do have some capabilities in that direction. And I think we have to come up with sort of a plan for how we want to bake ourselves into the platform at large, and we're looking forward to doing that.
That's great. I'm so glad it's continuing. I mean, just as citizen Andy here, I think if I had to name 5, the best examples, I would probably pick that as one in terms of evidence-based policy building a pipeline. So I'm so glad it's continuing.
Yeah, no, and I was very, very excited to be able to oversee it and be the keeper of the plane.
Right.
Although of course I'm getting a lot of pressure to change the name from my former colleague.
You're obsessed with 3 initials. They just say you're obsessed.
Yeah.
Justin.
So CEO is such a fantastic example of building evidence and that evidence supply within the context of one city. I'm at the Urban Institute, and so we're at this kind of building the supply of evidence and research base at a broader level. And one of the things that we often think about is that the divide between the supply of the evidence building and the actual demand of what is useful to city leadership on the ground. So I'd love to hear from your perspective what's actually helpful in both making the case for this type of data-driven, evidence-driven work and for operationalizing it and actually putting it into effect in your city.
So useful in terms of what do we need to actually get the job done in the city? I mean, I think it is, so at least for us in Philadelphia, we have some original ideas, but most of it's borrowed from other places. So for going to conferences and meetings and hearing what others are doing is helpful in bringing it back and thinking, okay, can we do this here? How do we figure that out? And that runs again from department to department. So when the Nutter administration was developing its sustainability strategy, we actually looked at Plan YC and looked at some of the things that it was doing and tried to figure out, all right, how do we model that in our own city with, again, specific outcomes, data-driven, what are we going to be measuring, what's in, we tweaked it so it's our plan, it's what's important to us here in Philadelphia, but it's based on sort of the same model of using data and what do we want the city to look like in 10 years, and how do we walk ourselves back from that. So Ben, including cities, does a lot of convening with chiefs of staff twice a year. Those convenings are really helpful to hear what's going on in other cities and what we can steal and borrow from, and then you follow each other and use advice.
Yeah, I would just add the hardest part, the hardest thing we really struggle with was really picking the right measure for different services.
Right.
And frankly, you can take a top. Sometimes I feel like we maybe should take a more top-down approach and say like what works and say, hey guys, this is what we're measuring. That's the end of it. But the reality in a government context is you really have to get buy-in from the folks that are actually gathering the data and reporting on it. And if they don't buy into it, they're not going to measure it, or they're not going to be involved in it. So I think I remember when we first started outcome budgeting, there was literally a room with finance, the mayor, her staff, saying, well, what should we measure? I mean, we weren't sitting around with like some very nice publication that says this is the right measure for these different things. We just were throwing ideas out there, and then we said, well, should we get to 5 per out? Okay, yeah, 5. So it's that's how it started. And then we refined it over time, and I think as we went back year after year, you hate to change outcome measures continually because you have to wait a long time to see if you're making a little bit of an impact. But I think if you don't have the right measure, you could be aiming for something that you're totally off track. So, I mean, we have used, we've looked at, organizations that kind of gather that data and look at what's the right benchmark and what's the right thing we should be aiming for. Some services are hard, frankly. They're just not a good measure to use. We actually use citizen survey data sometimes as a proxy for how well we're doing. I was talking to some folks earlier about cleanliness. It's hard to, you can't measure like pieces of trash per square foot. So we used to survey people and say, what is your perception of the city's cleanliness? Is it going up? Is it going down? Are we doing the right thing? And that has to serve as just kind of the benchmark in the meantime.
Yeah, Matt?
And I just had one, I think thinking across cities, another thing that I think cities, and you guys can speak to as well, I think people want peers. There's a strong uniqueness bias also that we've seen every city. I used to work in the Boston mayor's office, and I think a lot of cities feel like, great, I can see what Philadelphia and Baltimore is doing on some dimension, but maybe things are very different, the way the internal governance works or whatever have you. But I think having, whether it's a common standard or just a cohort of cities working together, so you have some sense of what the possible is. Every city may think they're the best, but when they're working with folks who are tackling things similarly. The second thing I'd add is, depending on what the issue area is, the kind of level of evidence is different. So for health and human services, you may want an RCT. For sanitation, you may actually just want like 1 out of 5 stars worth of data, just that a city has some emerging practice that seems like it's working well. So I think it's, there's some resistance in cities to RCTs. I think they're great and necessary in some cases. In other cases, I think you really need to calibrate the level of data and evidence to what the problem is.
And there's not really an easy way to figure out that, right? That's kind of a smell test or Bob's thing. It's like, well, that seems like one where we could decide it's this level and not that.
The other thing I should just
Suzanne.
add, when you are working with cities and discovering is you don't have time to read a lot of academic research work and things like that.
I worked in the city before, so
Yeah,
I was clued into
right.
that.
I worked at a foundation where we would put out a GQ and we would put out nice reports and then being on the end, we thought we were so valuable to policymakers, and then you're on the other side and like, it looks great and I don't have time to read it. But getting cities direct help is also really like a consultant to help us actually think through pay for success or those kind of models. Just
and sometimes it's like $5,000, $10,000, $20,000. They're not huge investments.
But you don't have necessarily the money.
Yeah, exactly.
One thing I would add to that, just one thing we've realized that, and our budget process is an annual budget process. We have to go to the council each year and get the appropriation. And what we try to do within legal constraints, within the charter requirements, is to really do like a really full-blown out outcome-based budget process once every 2 years now. So the off year is still very busy. There's still a lot of bureaucratic steps we have to go through to publish a book and everything. But we try to use that time in the off year to do a little bit of evaluation. Like our office does a little bit of evaluation. We do maybe 3, 4, 5 reports that we put together on certain issues that have been tackled. But again, when you have a small staff and you don't have the time, you really don't read that stuff, and so you have to figure out a way to just kind of carve it out. And that's one way to do it. I think especially budgeting when you're looking at resources. I think because we're dealing with outcomes, it's sometimes maybe not worth it to go through it every 6 months or every year because it takes long enough to do, and so you can use that extra time in the off cycle to kind of read that material or kind of collaborate with others or do your own internal research because of the only way you can free enough.
That makes sense. We may have time for one more, but hopefully two. Go ahead.
Mike Lawson, George Mason University. My question actually comes a little bit out of my own experience. My first half of my career was totally in public policy, and I worked for the International City County Management Association. The last half is largely in management. Now, in discussions of Moneyball, the focus seems to be mostly, if not exclusively, on policies that work, or programs or strategies that work. One of the things, and I think it's been reinforced by discussion today, is really management structures or cultures. You mentioned a culture of innovation. You know, and I talked to Andrew Klein, your budget director, so it's structured, whether it's budgeting for outcomes, whether it's city stat. You know, there are structures. How do we create structures and organizational cultures that are evidence-based, as well as and even examine, do those work? Right. Do they survive transitions from one mayor, one city manager, one county executive to another? Sure. And how does that compare to programs and policies that work or don't work?
Mindy,
well, it's not just, I mean, that's an excellent point, and it's not just that. You know, when we talk about performance management, I'm meeting with every commissioner now, and, you know, we have critical indicators, and what's going well is in green, and what's not going well is in red, you know how that looks, right? And, but the point is that when something's not going well and when something is going well, you don't want to just focus on what's not going well, you want to focus on what is and what isn't, and often the difference between the two is the management. You know, it's the same kind of thing, and in this one's going well and this one isn't going well, and the difference between the two is the guy who's running this one actually knows what he's doing, and the guy who's running this one, not so much. And then if you combine the two, you can really change the management structure of an operation, not even just the management structure around a culture of evidence or managing to evidence or whatever. So I think the management structures themselves matter throughout if you're trying to get to a place where things work. You can't forget about who's doing the work and how they're doing it.
Including where you now have CEO, right? I mean,
exactly.
The ability to cut across is going to be way different.
That's totally right.
And we did that. So when Michael Nutter became mayor in 2008, the city structure in the zip charters or constitution set up, there was a managing director's office, and that managing director had specific line authority over the streets department, the fire department, the police department. So anything from under operation is under that person. What the Mayor Nutter created were deputy mayors who took some of those departments. So, for example, the deputy mayor for health and opportunity has Office of Supportive Housing, Office of Behavioral Health, the health department, and the Department of Human Services, all under his purview. That creates a management structure where he's responsible for all of those departments which touch each other in very real ways, whereas before they had been divided sort of all over the city government. So it forced them to start working together and determining how does the homeless street population and the Office of Behavioral Health, their policies impact each other. So getting those two commissioners to sit side by side day in, day out, and talking about their work drives different outcomes than what has been previously.
Hi, Rob Ivey from MDRC, but I'm going to talk through my lens of what's working for the mayor of Baltimore back in the 70s. And at the time, we always thought of trying to do things from a perspective of triple social utility, where you're making investments in low-income populations in terms of their training, their skills, and educational development. And then what they would do with those skills would be to apply it to increase the supply of affordable housing, for instance, which would then change neighborhoods and reduce crime rates. So in thinking about evidence, I think it's important to think about it both in terms of the populations that are being served in a particular program, but the impact that program, that intervention may be having on neighborhoods, and then ultimately how that affects the health and vitality of the city. And it was always a very healthy lens to maximize the opportunities in which you could have this triple win.
Last question, I believe.
Well, I just, was, as I was listening to you, wondering if there's anything the state governments or the federal government could be doing to be helpful. So I think about
That's an explosive last question.
And give the money right to the city. That's
That's
the
a
federal
conversation.
government could change
Enablers or inhibitors?
how it's, how
yeah,
it's
and that was
funding
it was
flows.
enablers and inhibitors. So I'd love to hear that offline. Since clearly that's opening up too much.
Oh my God, yeah, that's the third rail, whenever you get the cities together.
I mean, I think that certainly, I mean, I feel like, competitive grant funding would be, I think would be great. I mean, more of that would be great because I think you would force people to have to put their case together. I mean, just like we're dealing with our agencies and say, put your case together for why you're receiving the city's general funds. I think it would be a little bit frightening at first if we were to say, okay, we're cut off from this one direct source of funding. Baltimore does pretty good in Maryland, and then we get like a disparity grant that says you get this much money and it's totally yours to spend how you like it. But I think local governments would have to adjust and have to innovate to respond if states were giving out money more in that for that matter. Like obviously there's other.
I should say, and I just mentioned, I just learned about Massachusetts, which there's something called StatNet in Massachusetts, which is one that the state funds it. So and it brings peers who are essentially doing stat systems together to learn from each other, and they've really developed that model, I think, quite nicely, so that they also bring in program managers when they focus on different programs, inspectional services or firefighting or whatever. So that's one model I know of, but I'd love to hear about other models so we can be helpful on that.
Great. I want to thank the panel. Fantastic conversation.